guys, I'm Johnny. I'm on PGY3. Um, so in the theme of today's lecture of disaster and my topic of wilderness, I want to talk to you guys a little about toxic plants and its historical uses. I know most of us, and probably a lot of the attendees here, probably have never even seen most of these cases, but they do come up in exam questions, so it's good to know some of them. And so the purpose of my lecture is not to go too much in depth about them, but maybe just to make some quick associations that will maybe help you guys out with recognizing them. So starting with just a quick case, 20-year-old male comes to the ED because he drank some tincture from his dad's homeopathic clinic. Shortly after like an hour, he starts developing abdominal pain, nausea, vomiting, diarrhea, and then he starts having palpitations and then feeling uneasy. Any quick guesses of what he may have possibly taken? Jimson Wee's a good guess. But uh, the problem with all these toxins and a lot of these stuff is that they all present very similarly, and that's why it's such a difficult topic. This one in particular is actually aconite. So this this flower, also known as like monkshood or wolfsbane, grows natively in like Europe and Asia, but it's now spread around the world and can be found pretty much everywhere. It's been widely known and throughout history, even since like ancient Greece and Rome, to be used as a potent poisons. Oftentimes used as like hunting tools, thus the name wolfbane, and then also used incorrectly and mistakenly for its medicinal purposes. Um, Pretty much very little medicinal use for it, but they have definitely tried. But something to help you guys remember, another name for aconite that people may help with is mother-in-law's poison. So you think of a mother-in-law's poison, how would you try to poison somebody with this?
I'd be poisoned by the mother-in-law trying to poison her.
Either way. It's pretty good guess. Uh, yeah, most likely you'll think like stick something in the food, right? Um, so one of the famous historic use of this is Emperor Claudius, if the Roman emperor ruling from like 8041 or something, was poisoned by not his mother-in-law, but his wife, although technically it was his cousin and also his fourth wife. Because, history. Um, Basically, it's proposed that she laced his mushrooms with aconite. Um, you know, this was in order to get her son from a previous marriage to try to get him to rule. So in that case, you could kind of think of it as stepfather in law. But yes, so after his death, it came Emperor Nero, which is a much more well-known emperor, and that became his reign. So with these poisonings, what are the effects that you see from it? So you think about kind of like the route that it comes in, poisoning food. Your initial symptoms typically be like severe nausea, vomiting, and diarrhea, before it progresses to like arrhythmias, dysrhythmias, and then ultimately their death. And then you think about thinking about these effects, you can kind of come up with like the mechanism that the aconite kind of works. So the toxicity of aconite and its related alkaloids, which is like many found within the plant, they bind to the voltage gated sodium channels of cell membranes. So this causes like a refractory state within the cell membranes, and thus like causing like irregular action potentials. This activates the GI system, causing peristalsis, thus the vomiting and the diarrhea, and then in the nervous system causes the paresthesias, the numbness, and then finally in the heart you get this arrhythmogenic state because of the excited states of the cells, and especially the myocardium. How do you treat this? A lot of it's just going to be our basic ACLS. There's really no particular antidote for it, so you just kind of, the main thing is going to be the dysrhythmias. There's no one particular type of dysrhythmia caused by this poison. So for your like ventricular arrhythmias, you try like amiodarone, similar to like your basic ACLS guidelines. Wine and QRS, you could give them sodium bicarb. If they start having like torsades, you give them the MAG. And then a lot of these patients may benefit from ECMO, to provide that support of this refractory arrhythmia. until the body actually metabolizes the toxin. So if you're gonna remember anything about aconite, mother-in-law's poison, mostly GI symptoms before they finally died. All right. Next case. A 23-year-old male presents to the ED after found unresponsive at the farm. En route, he had multiple tonic-clonic seizures. Later, he reports that he's trying to make a tea from a valerian root he collected from a nearby stream. This is a picture of valerian root flower. Any guess as to what he may have poisoned himself with? Yeah, I don't expect you guys to recognize flowers. This is hemlock. It looks very similar, and this is kind of the mechanism of most poisonings, just like mistakenly taking something that they thought was maybe harmless or fine. And that's usually how we see like a lot of these poisonings today. So hemlock is found throughout like North Europe and North America. It is part of the carrot family. So this is why like a lot of people do mistakenly mistaken this plant for something that may be harmless. All parts of the plant is toxic, especially the roots and seeds. Like a single adult ingesting like 100 milligrams of this, which can be just like a couple of leaves, can be fatal. So one of the most historic uses of hemlock is probably in the story of Socrates and his death. So Socrates, we know him as like a famous philosopher in his days. He was convicted of corrupting the youth of Athens by introducing like strange gods and thoughts. Rather than fighting the conviction, he chose to drink the poison rather than to renounce his beliefs and then flee his place. Thought of to be like as a final lesson to his students. He argued that he had always tried to seek the truth and justice, and that questioning the Athenians' beliefs was not intended to harm, but to value critical thinking. All right. The reason why I bring up his story is because uh, the toxin in hemlock is tannin. It's a potent nervous system poison. It causes profound blocking of like spinal cord reflexes. Initially, like a little bit stimulatory, but then severe nervous system depression. So it's kind of ironic if you think about Socrates in his final moments. Essentially, what he would have been is that he would have been progressively paralyzed, left only to his thoughts to contemplate about his sentence before finally leading to respiratory depression, suffocation, and his death. Yes, very, very morbid toxins. But hopefully this kind of helps you remember the effects of it. So the way that hemlock works is many alkaloids found in this plant. It is especially canine. It is a nicotinic acetylcholine receptor antagonist. All right. So it works very similar to some common meds like we think of like rocuronium or vecuronium. Essentially, it competes with the receptor, the acetylcholine receptor, at the motor end plates, preventing the depolarization of it, and then preventing like calcium cells from relaxing, and then thus preventing muscle contraction. So most of this is going to be like paralysis and then respiratory depression. And the treatment of this, like most of these other poisons, is going to end up being supportive. This is going to be your main thing will maybe be like rapid sequence intubation for these patients because you want to keep them breathing as they slowly start to not be able to do that on their own. Some deaths have been reported to be prevented by like mechanical ventilations. If you can if you could like stave off the effects for like 48 to 72 hours and the body's able to metabolize it, and then possibly prevent death. All right. Next case, a 60-year-old woman is transferred to the ED from poison center. She and her sister had ingested some plants that they thought was lettuce in their gardens. Following the ingestion of the leaves, they had like delirious, weakness, lethargy, dizziness, later escalated to like restlessness, agitation, and confusion. I don't know. These all end up sounding kind of similar at some point. Any thoughts of what they may have ingested? Yeah, these are rare poisons that we really shouldn't be seeing much of. Nightshade, Tropa belladonna, as its name goes, or Milan is like pretty woman. It can be found throughout the world. It's sometimes used recreationally for its like hallucinogenic effects. But in ancient times, and especially during the Renaissance, women used to use these juices in the eyes to help dilate their pupils. Um, they rub it on their cheeks, make it more flush and like look like blush. Thus the name Pretty Woman. Um, but yeah, these are very toxic poisons. One of the more historic uses of it is Cleopatra. She used to use nightshade for the purpose of dyeing her eyes to make them look more seductive. The paralytic in it would, would take out the muscles that constricts the pupil, causing it to dilate, and to give them that kind of like dreamy-ish look. Because I guess even back then, giant anime eyes was always the standard of beauty. But maybe more so is because of these eyes. Business history. So the toxic effects of belladonna, you'll see patients come in hot, flushed, dry, dilated pupils, maybe urinary retention, and then confused. Based on these symptoms, can anybody guess the toxidrome and maybe the mechanism of belladonna? I think I heard Max say anticholinergic. All right. So just based on these symptoms, you can pretty much guess the active components of belladonna, and also part of this name, Atropa belladonna. So the mechanism of toxicity of nightshade comes from the fruits and leaves of plants, which is going to be contains like high levels of alkaloids. Namely, it's going to be atropine, scopolamine, and hyoscyamine. And then the treatment for this, we should probably know. Guys, never mind. Treatment? Physiostigmine. So physiostigmine is probably one of these few things that we can have a kind of more direct antidote for. Never mind.
They gave it recently. Tried to give it this weekend. I found out it is not approved in the United States anymore. No hospital has it.
Well,
You can buy it in Europe and import it.
if for some reason, no. Well, if for some reason the hospital does contain it, you give 0.01 to 0.03 mg per kg slowly over 5 minutes with a max dose of 0.5 milligrams. And then if no response, you repeat that in like 5 to 10 minutes with a maximum total of 2 doses. Benzos is the next best thing that you can do for them. You give like Ativan 0.05 to 1 mg per kg for the agitation. And then the rest of it's still going to be supportive care. All right. Quick next case. Male teenager intended to die from ingesting 200 beans after he mixed and blended them into a juice. 8 hours later, started having like weakness, lightheaded, nausea, vomiting, and then finally regretted his decisions, went to seek medical treatment. Any beans you guys know of that are toxic? Castor beans is probably the only one I know of you too. But castor beans is pretty much found throughout the world. It's used widely for many reasons. Part of it is like castor oil, which is used a lot in our specific population for their like skin and hair supplement reasons, and also other reasons that they come up with that I've never heard of before. But this is kind of like the ricin within the castor beans is kind of the waste product as the castor oil is made. A single bean contains about like 5% ricin by weight. So a handful of these can be fairly lethal. It's been used since like medieval Europe, mostly for like assassinations because of how potent of a toxin it is. And even to this day, it's still often used in political assassinations. But one of the most well-known uses of it that we may be more familiar with of from Breaking Bad. So the median lethal dose of ricin is like 22 micrograms per kg, which you can get that in like a single bean. The good news is that it's poorly digested, so just eating it straight up doesn't give you the full dose of that. But if you were to like crush it down and increase the absorption, like 5 to 10 beans is enough to really kill an adult human. So the effects of ricin is really going to depend on the route that it was exposed to. Because it's more often used in assassinations, that the route is more than just ingestion. A lot of times it can be made as an inhalant or can even be injected under the skin. As I forgot who it was, but there was some dictator that
KGB kid.
some KGB
It was
kid.
the the umbrella.
Yeah.
There was a kid first with the umbrella, went through the skin. It was a pneumatic umbrella device that shot a steel helmet. Yeah.
Yep.
held the rice in it into his leg.
hollow tip.
Yep, and killed him.
Yep.
It was in New York City.
London.
London.
Yeah.
78.
Well, it's like, I was.
He was a man on the grassy knolls.
Yeah.
We're gonna find out soon.
So when you think of ricin and its effects, think of the routes that they were probably exposed to. So when it's inhaled, it causes like a lot of coughing, wheezing, dyspnea, shortness of breath, sore throat, congestion, and before they develop like pneumonia, pulmonary edema. By ingestion, you expect like nausea, vomiting, diarrhea, hematemesis, melena, necrosis of like the gut and spleen and GI organs. And then for injection, you're looking like more local erythema, blisters, indurations, necrosis. Obviously, once it absorbs into the rest of the body, all of these will end up with all of these symptoms. But you think but the mechanism kind of explains why there's such a wide range of symptoms that they present. Ricin inhibits the protein synthesis of cells and thus disabling the ribosomes. This leads to like widespread death of the cells and thus the organ failures. So whichever one's organs are affected or gets the toxin first, those are the organs where you get the damage first, and those are the symptoms that these patients will present with first. But it's a prolonged process. They can kill you pretty quickly, but usually it's something over like days. Like you ingested it here, and then you die a few days later as you slowly go through all your organ systems. And the treatment for ricin, good luck. Really, there's no antidote. It just destroys all the cells. There's nothing we can do to re-target it. All we can do is just supportive care. Mainly you'll be like treating the hemodynamics, you'll treat seizures with benzos, you give ventilatory support for those who have respiratory distress. If it was recently ingested, some suggest that maybe you can try activated charcoal, but really it's good luck. And you just hope that you didn't ingest a large amount of it or poisoned with it. All right. One last case. A 67-year-old woman comes to the ED 3 days with nausea, vomiting, palpitations, and discomfort. Started after her husband tried to make her lunch from the garden. She noticed that her pulse was becoming slow and irregular, and then a few hours later started feeling like chest pressure, abdominal pain, and cramping. This is the hard part about a lot of these poisons. Like I said, they end up sounding very similar. Digitalis. So oleander and foxglove, they kind of present similarly. Their mechanism is pretty much the same, so it's a little hard to differentiate the two apart. But these are both flowering plants that are found essentially everywhere, mostly because of the vivid colors, and people like to landscape with them and things like that. The thing to remember about dig and these things is that most of these poisonings usually come from chronic toxicity, although you can still acutely be poisoned and have severe effects from it. So the effects of the DIG and oleander, it comes from cardiac glycosides. Most of these symptoms are pretty non-specific. You get like headaches, malaise, insomnia, confusion, abdominal pain, nausea, vomiting. Um, certain things that you may see is like heart block and other arrhythmias. One of the more specific things they may see in like questions is like that yellow hue in the vision that they may see. So that's more specific to like DIG, but you can see it in both oleander or DIG. Um, and as most of us probably know the mechanism, it's going to be the inhibition of sodium potassium pumps. It reversibly inhibits the ATPase, causing like increase in the sodium channels, which then causes increase in intracellular calcium, which causes excitation and polarization. DIG also has a direct effect on the increasing vagus tone, which can lead to like more like blocks, like prolonged conductions to the SA and the AV nodes. Some major electrolyte complications you'll see with DIG is going to be hyperkalemia, as it like blocks the sodium from going out of the cell, so there's no transfer of potassium, so you get some hyperkalemia from it. The reason why DIG and oleander is important to know is because it's one of the few poisons that has a specific antidote for it, and that's going to be digoxin specific fab or digifab. The treatment of this is going to be like 10 vials of fab for an adult and 5 vials for any children. The way it works is that the digitoxin specific antibodies will bind to the DIG, and then it gets renally excreted. But it can lead to also significant hypokalemia, so you should monitor the potassium if you're giving patients digifab. All right. So those are my references.